Pain in the knee? Oh, it's so common nowadays. This is what we hear when we complain of something. Hello everyone, welcome to my channel Peter the Rock. We have learnt the definition of osteoporosis in our school. It is a softening of bones. Cases of osteoporosis can be seen between the age of 25 and 50. It's about bone density. It tends to stay stable with equal amounts of bone formation and bone breakdown. After age 50, bone breakdown outpaces bone formation and bone loss often accelerates, particularly at the time of menopause. For many women, the disease begins to develop a year or two before menopause. Now let's not get confused between osteoporosis and osteoarthritis. Osteoarthritis is an inflammation of the joints which can arise due to autoimmune reaction or joint usage over time. Low mineral density in the bones causes osteoporosis. Today our focus is on osteoarthritis. Yes, as I am undergoing hormone therapy, I suddenly developed a lot of pain in my right toe and right knee. If I stood even for 10 minutes, my knee would pain a lot. I would get a feeling that if I walked in that pain, my bones would immediately break. So in such a grim scenario, I consulted an orthopedician who asked me to get 3 things done. 1. X-ray of both my knees. 2. Uric acid test. And 3. BMD test. BMD, that is bone mineral density test, measures calcium and other minerals in bone. My X-ray report said that I have more osteoarthritis in my right knee. The BMD test was done using Lunar Prodigy Advanced DXA system and it measured at AP spine L1, L4, giving me the T-score. Uric acid test is done in people who are having cancer treatment, including chemotherapy. When cancer treatment kills cancer cells quickly, they release large amounts of purines into the blood. Uric acid is the end product of purine metabolism. In my case, uric acid levels was not a problem. The cartilage between 2 joints started wearing out, because of which the gap between 2 joints reduced and the bones started rubbing against each other, causing a lot of pain. Now osteoarthritis has 4 stages. Mine is stage 3, where the cartilage in the affected area begins to erode. If it is stage 4 arthritis, the case is irreversible. Apart from taking low doses of painkiller, tablets to reduce inflammation, physiotherapy aids in resolving the issue. The physiotherapist shows knee exercises to be done to strengthen the knees. Now, is there anything to worry about when timely treatment is given?